As we look ahead to a new administration in the USA, as well as new hopes and challenges for the years to come, the APHA has a mission to make health a top priority for our nation, a vision shared by Dr. Virginia Caine, president of the National Medical Association, who joins us now. Thank you for being here.
Thank you for having me.
So first, let's do a check. What do you think about health as a top priority in this nation? What's our grade? Where do we stand?
So I think we're probably as a grade, and when you go from 1 to 5, with 5 being the top priority, we're probably a 4.
Okay.
I think we saw the consciousness of folks realizing how important health is, and when we looked at some of the adverse health outcomes that occurred as a result of COVID-19, a lot of attention was brought to it, especially when we looked at all of those hospital, public health agencies that cared for this epidemic of individuals who were impacted. Before we had a vaccine, they put their lives at risk related to the contagiousness of this. So this really caught the attention of the public.
As you look ahead and you think, what do I want our public health system to look like? What does a system look like that really champions health as a society?
We have to really improve our access to health care. So, public health is about assessment, policy development, and assurance of services. But we've seen a tremendous gap in our income and social status of a lot of our populations, and we're having new individuals come into our country that are now living with us from other countries. And so how do you navigate that healthcare system?
So you bring up the policies. What do you think are the key policies that public health professionals should be trying to drive forward?
I think it's always so important that we have to do the research and we have to promote evidence-based science in terms of our policies. But it also involves getting the best experts in place to say, what recommendations should we make based on the data that we have today? And that's the one thing when we look at the misinformation out there, how do we educate the public that we're making recommendations as the science evolves?
So as an infectious disease specialist, talk to me about the intersection of individual health priorities versus national and collective health priorities.
So public health is all about looking at populations as a whole in its entirety. And we know the individual health relates to taking care of that individual patient and addressing those conditions. So we're very interrelated. And this is a key piece that was missing, that we don't see as much in our healthcare systems. They don't always have the expertise of addressing the social determinants of health. So, safe housing, food insecurity. So who addresses the safe housing? Public health agencies working in partnership with their healthcare systems, addressing those food insecurities. Who goes into those vulnerable populations? And so we have to have those mobile systems, mobile testing sites available in those areas where they reside.
So what's your hope for the future?
I'm excited about the future. Just coming to the conference of APHA, and I see all of that young generation and just people from across the country that are here. And I've attended a lot of the sessions, and oh my God, the information that's shared, the experiences where people are sharing their success stories has just been incredible.
A lot of people with the same commitment. Thank you so much.
It's the passion, remember, and the energy makes the difference.